When we think about healthcare, what comes to mind? Probably doctors, nurses, maybe hospitals, right? But what if I told you one of the most critical parts of a patient's journey has nothing to do with medicine itself and everything to do with just getting a ride? Today, we're going to dive into this often overlooked world of medical transport and why it plays such a vital role in the whole chain of care. So here's what we'll cover. First, we're going to identify a pretty big but hidden hurdle in healthcare. Then, we'll get into what continuity of care actually means. After that, we'll look at the solution, figure out what makes it tick, and see how it all fits into the bigger picture of a patient's well-being. All right, let's start with the core problem here. For a lot of patients, especially seniors or anyone dealing with a chronic condition, just getting to a doctor's appointment can be a huge challenge, and that single challenge can completely undermine their entire treatment plan before it even has a chance to start. I mean, think about it for a second. You could have the best doctors in the world, the most advanced treatments, a perfectly scheduled plan, but what good is any of that if the patient just can't get there? That simple logistical gap, that becomes the weakest link, and it can make the whole plan just unravel. This is exactly where so many health journeys get completely derail. So this transportation problem, it directly threatens a really vital principle in medicine. It's called continuity of care. You probably hear that term thrown around a lot in healthcare circles, and for a really good reason. It's pretty much the backbone of any effective treatment. So what is it really? At its heart, continuity of care is all about consistency. It's this idea that a patient's health journey should be smooth, it should be connected, not just a bunch of isolated, disjointed visits. When patients can actually make it to their appointments on time, every time, their doctors can track progress, adjust treatments, and catch problems early. It's all about keeping that forward momentum going.
And what happens when that momentum is broken? Well, the consequences are pretty serious. Just one missed appointment can trigger health setbacks that were totally avoidable. It can throw a whole treatment plan off course, and this can lead to preventable complications. But just as importantly, it really erodes a patient's confidence, making them feel disconnected from their own health. The stakes? They really couldn't be higher.
Okay, so with stakes that high, how do we actually fix this broken link in the chain of care? The answer is a specialized service called non-emergency medical transport, or NEMT for short. And let me be clear, this is so much more than just a taxi service. It's a real healthcare solution designed specifically to bridge this critical gap. And you know what? The impact of having reliable transport is immediate, and it's profound. For starters, patients actually show up for their appointments. That right there dramatically increases how effective their treatment is, and it boosts their confidence. But there's also a huge economic benefit. By cutting down on costly no-shows and preventing complications, it helps reduce those super expensive hospital readmissions. In a way, reliable transport is actually a form of preventative care. But here's the thing, not all transport services are created equal. That word quality is absolutely key. Real, true NEMT is built on two fundamental pillars: the professionals who are behind the wheel and the specialized vehicles they're driving. Let's take a look at how these two things combine to create a service that actually works. First up, there's the human element. A professional NEMT driver isn't just some person who drives. No, they're a trained, compassionate expert. They get patient needs, they know how to handle mobility challenges, and they're skilled in safely getting passengers on board and securing any devices. Their calm, professional, and on-time presence actually helps reduce a patient's stress, which makes the whole ride part of the healing process. And second, you've got the equipment. We're talking about modern, well-maintained vehicles that are designed specifically for this job. They're equipped to handle wheelchairs, stretchers, or passengers who can walk on their own, making sure the journey isn't just safe, but comfortable too. The right vehicle minimizes physical strain and just makes the trip accessible for literally everyone. So, you can see right here how these two pillars work together perfectly. You've got the human touch, that compassionate driver who helps reduce stress, and you've got the right equipment that ensures safety and accessibility. It's this powerful combination that turns a simple ride into a genuinely supportive healthcare service. And because of all this, a quality NEMT provider isn't just another vendor. They become a real, genuine extension of the healthcare team. They're a true partner in making sure the patient gets the absolute best care possible every single step of the way. So here's how that partnership actually works in practice. It's simple. A medical facility schedules the transport. Then, the NEMT provider confirms all the details directly with the patient. No confusion. The patient then arrives safe, sound, and on time for their appointment. And because of this seamless coordination, the doctor or therapist can focus 100% on treatment because they know all the logistics are completely taken care of.
This quote, I think it really says it all. The ultimate goal here with a service like this is to completely remove transportation as a barrier, to make sure it never, ever stands in the way of someone getting the quality health care they need and, frankly, deserve. So, what's the final takeaway? It's this. We have to start seeing consistent, safe access to medical care, not as some luxury or an afterthought, but as a fundamental, non-negotiable part of any successful care plan. When we bridge this transportation gap, it directly leads to better health outcomes for everyone involved. It's that simple.
And that really leaves us with one last important question to think about. If we believe that quality healthcare is a fundamental right, then shouldn't safe, reliable, and dignified access to that care be a right too?